And let's look at your record in health. You said all Scottish patients, 100%, should start receiving treatment within 12 weeks. Did you wrote that guarantee into law when you were Health Secretary, the longest-serving Health Secretary? What proportion of patients are getting treatment within 12 weeks?
We're not meeting that target. It's below, it's the 80% or so. It should be 95%.
It's 72%.
But we're not meeting that target. We're not meeting...
It's 72.
Indeed, it is not good enough. But all health services are undergoing pressure from increased demand. Scotland is no different there. What is different in Scotland is the focus we are bringing now to addressing these issues. So if you take the Audit Scotland report that was just published a few weeks ago, a couple of months ago, their annual report on performance of the NHS, they say that on 7 out of the 8 key waiting times targets, including that one, there are now more people being seen within those targets than was the case in the year before.
But it also said that out of these 8 targets, you're only hitting 2 of them.
Absolutely.
2 out of 8.
Absolutely.
And can I just say, you made this 100% target a legal guarantee. I mean, have you or the health minister been charged with breaking the law?
It's not a criminal law, but...
No, but it's a civil offence.
But it sets out the steps that health boards have to take.
Guarantee.
We have set out, we've got an £850 million waiting time improvement plan underway. The Audit Scotland report, which you've quoted to me as well, more patients are being seen within these targets now than in the year before.
What's the point of a legal guarantee then? It means nothing, does it?
Well, there's 1.8 million people since that came into operation that have been seen within that target that would not necessarily have been...
But
1.8 million people have benefited from that. That is the point of having those kind of targets.
You are way behind.
I'm not denying that. All health services have these challenges. We are addressing these challenges. In many of these targets, A&E, for example, we are way ahead of the performance of health services in other parts of the UK.
Well, do you think it's a comfort to someone in Glasgow that they're not having to wait as long for somebody in Grimsby?
No, I don't. What I'm saying, I regularly get challenged by Conservatives and Labour in the Scottish Parliament saying if only we were in power, it would be so much better. I don't think it's unreasonable to say, yes, we have challenges in Scotland, but we are dealing with these challenges more effectively than these other parts of the UK.
Look, only 2 of your 8 waiting time targets being hit. You've been in for a long while. You haven't hit the A&E target since 2017. The 2-month cancer target you haven't hit since 2013. Children are dying in a new Glasgow hospital because the water's contaminated, perhaps by pigeon droppings. A new multi-million-pound Edinburgh hospital should have opened in 2012, is still unfit to open. You can't even get the ventilation system to work. You've got the worst drug addiction problem in Europe, but you cut drug treatment budgets by 15 million. You clung on to your last health minister. You're under pressure now to sack a successor. I mean, you've called for legislation to protect the NHS from Donald Trump. Maybe the NHS needs legislation to protect it from Nicola Sturgeon.
Well, obviously, I don't think that's the case because we are focused on addressing... You've put forward a number of legitimate issues there that are all challenges.
Well,
look, but these issues, I mean, if you take waiting times, we have the Audit Scotland report saying that we are seeing more patients within these targets because the investment we're putting in is having that effect. So we are having improvements and delivering improvements. There have been issues with the construction of the Sick Kids Hospital in Edinburgh with a ventilation system. We are putting that right. There is going to be a
9 years late and it's still not open.
There have been construction difficulties. I don't deny that at all. There is going to be a full public inquiry into the reasons around that. On drugs, we have an issue. Some of the reasons for that go back a long time. We have a task force that is looking at the solutions we have to take forward there. We have increased the investment in drug treatment services. So health services everywhere have challenges. We are not immune from that. But I believe that we are doing the things that are required to fix those challenges and to make sure that we have the health service that people expect. And patient satisfaction ratings for NHS Scotland remain extremely high.
They're high in England too.
Well, look, but on many of these things you're talking about, what we are doing in Scotland is way beyond what any other part of the UK is doing.